It's time for Motivational Monday. Let's talk NCLEX. So glad that you're here. Hey, it's Labor Day, but that's okay because we are laboring to pass NCLEX, and we have an amazing, not only motivation. You guys know how I like to bring the motivation from my personal experience, but we also have some great NCLEX questions just to get you aware that yes, you have to know the content in order to pass the NCLEX questions. So I'm so glad that you are here with me. It is the number one NCLEX instructor on the planet. My name is Regina MSN, and our program today, we like to call it Monday Motivation / Let's Talk NCLEX. And already people are joining me, letting me know, you guys are letting me know that you don't take holidays off, that you're here. And what I find actually is those who endeavor to work even when other people are taking the day off and relaxing, those people that work are the ones to get to their goals faster. So I appreciate you guys being here. Good morning, good evening, good afternoon. Happy Labor Day. Happy Monday. It's a perfect way to start our week here. The topic for this week is a good one. It is called Reach Your Full Potential. That's what you need to worry about. On this Labor Day, are you reaching your full potential? But I always like to start off Monday Motivation with motivation from our very own ReMar nurses. Let me just read to you what she said. I like this. She says, "In the name of Jesus, I killed the beast." That's like an awesome testimony right there. "I passed my NCLEX by using ReMar. Thank you, Regina and Mark. As you said, Regina, content is the key. You helped me so much with prioritized questions." She meant priority questions. "I don't know how to thank you, Regina, but blessings, but your blessing is on God's hands. Thanks a million." I like that. Your blessing is on God's hand. Shout out to Nurse Melissa. Just got her license. Wrote that on the ReMar for NCLEX Facebook page. If you guys are not getting notifications when we come on, you need to click that bell button so you can hear when I'm going to be live, because we have so many events coming up. This is our season right now. When we transition into fall and into winter, ReMar Review, we just go wild around here about NCLEX, and we have a lot of fun during the holidays. We just have a lot of program and events for you guys because we love you so much. One of the things that we have coming up that is going to be an amazing opportunity for you guys to stay engaged in your studying is we're bringing back ReMar Nurse University. And of course, whenever we do ReMar Nurse University, you guys know it is just like a bang out event for us. So we go all out this year. For this event, we are going with the NCLEX and helping people with their TEAS. Oh my goodness, I've gotten so many emails. Regina, when are you starting TEAS? When are you helping with TEAS? Regina, what is TEAS? I just found out I have to take it. So our back to school nursing review, actually the location is Youngstown, Ohio. Youngstown, Ohio. So if you are in the state of Ohio, if you're in Youngstown, Akron, Cleveland, or if you know somebody in these areas, let them know. Northeast Ohio, ReMar Review is holding a free event Sunday, September 15th. It will be from 2 to 5 p.m. Even if you are not in this area, you guys know that you can watch this review online. Yay! You can watch it online if you can't make it, but you got to sign up. And the reason why you got to sign up, I says, I got to do this. Yes, the reason why you have to sign up, all right? Reason why you have to sign up is because you'll get the workbook as well to follow along and take your notes, and you'll also be engaged in what is happening. Now, I see some people saying, yeah, but I only want the TEAS. I only want the NCLEX, or I only want the TEAS. I don't want both. The way I've structured this class is that if you're present for this class and you're just studying for NCLEX, the TEAS information that I'm going over will help you for NCLEX. Because if you know what is on that TEAS exam, the science portion of the TEAS exam is anatomy and physiology. And those components are necessary to understand if you are taking your NCLEX exam. Now, for me, when I was preparing for the TEAS, it was hard. The science portion of the TEAS, that anatomy and physiology, just because you made it from nursing school, that doesn't automatically mean that you remember that stuff. All right. So I think that when you see the workbook, when you sign up and you see the workbook, you'll be like, I need to review this information. And as well, I'm going to make it easy for those pre-nursing students. If they want to take a look at the NCLEX information, just prep them on seeing how it is going to be for them when they get through nursing school. So for my ReMar nurses, if you know someone that wants to be a nurse, that wants to follow in your footsteps, remember your job, one of your jobs as a ReMar nurse is to bring somebody into nursing with you. This is a perfect opportunity for you to sign up for the event and then tell that person, hey, why don't you attend this review? Why don't you learn about how you can get into nursing, the things you have to do? This is that opportunity for you to give back. So it's an easy way to give back. It's an easy way to share this event and get everybody you know who's interested in being a nurse. I can name about 3 or 4 people that have come to me in the last 6 months and said, I'm thinking about being a nurse, or how is it being a nurse? What do I have to do? This is an opportunity for you to fulfill that need. So share this event with anybody that you know that is interested in becoming a nurse. We're doing an NCLEX and a TEAS review, and we will be able to provide assistance. Hey, a lot of you guys are new. Somebody say, yes, TEAS, please. Yes, I know. It's finally happening for us. We're so excited. So the website here is remarnurse.com/RNU. Sign up today. Sign up today right now. Drop it off, because this event is actually in just about 2 weeks or so, September 15th. So this is an opportunity for you to do that. Also, a lot of you are new to ReMar Review, and I'm so happy about that. We have some people that have been here for a long time, but also, we have a Labor Day sale for you guys. So for today only, if you sign up for RNU, then you will get, I'm just letting you know, Mark, they want you to pray for the Bahamas and Florida. He said he would do it. I just asked Mark to pray for the Bahamas and Florida, and we will definitely be doing that. Those two are our spots. We just came from the Bahamas not too long ago. We love Florida. We love the Bahamas. So today, sign up for RNU. Sign up for RNU, remarnurse.com/RNU, and you will get a code sent to you in that sign up that will give you 35% off of either the Quick Facts or the Question Bank book or any Quick Facts product. So these are the 2 products for today. These are our Monday special products. We like to highlight ReMar products. So today is Quick Facts. If you sign up for RNU, you can get 35% off of this book. Or a lot of you guys don't have the Question Bank book yet, which is my newest product. I love this book. A lot of questions about telehealth in here, the delegation questions, the cardiac questions, they all are in here. So you can get 35% off the Quick Facts or 35% off of this book right here, only for today. But you gotta sign up for RNU. You gotta sign up. Is the Quick Facts DVD included as well? 35% off of this product. So that's basically just like us giving it to you. All right. So these are the happenings for today. I'm super excited about the TEAS review and the NCLEX review together. ReMar Review, our family is growing. It's just growing. So thank you guys so much for your contributions. This is your Monday motivation right here. Reaching your full potential. I'm talking about reaching your full potential today. And I want you guys to take personal responsibility for that, because you can't ever blame, when you think about reaching your full potential, you can't ever blame somebody else when you don't reach your full potential. You can't say, oh my goodness, my boss is keeping me from reaching my full potential, or, my kids, they weigh me down, I can't reach my full potential, or the government is keeping me. No, when you don't reach your full potential, you have to take personal responsibility for it. And I'm not just speaking it to you guys, I'm speaking this to myself, because in our lives, when we want to do something, the very first thing we do we have to make a decision on what that thing is. We have to be able to decide, okay, this is what I want to do, and this is what I'm doing no matter what. Because normally when we first have that idea about what we want to do, when we first make that decision, we have a lot of courage at that time. It takes a lot of courage to say, you know what, I'm going to go out and I'm going to get a nursing degree. I'm going to finish school. I'm going to get my license. That takes a lot of courage for you to do. And so when you make that decision with courage, but then you spend time going around telling other people, what do you think about this? Looking for other people's approval to do your dreams, live your dreams, then what happens is those people sometimes they have the opportunity to plant negative seeds or discourage you from doing it. And so then you lose all that courage that you had in the beginning, and you find yourself not doing the thing that you initially wanted to do. And I'm speaking from a personal experience because you guys know that right now I'm in school, right? I just started school. I'm a doctoral student officially, turning in assignments. I'm writing your guys' position. I got a tutor. I'm studying. I'm up, all day. Yesterday I spent studying. And it's horrific. Okay. It is so tough. But let me tell you this. I just started school in August, but last December is when I wanted to go to school. And I made a decision saying, I'm going back to get my PhD last year. But you know what I did? I was on the phone with my best friend one day. And I said, I want to go back to school to get my PhD. And she said to me, are you crazy? All the stuff you got going on. You're doing ReMar, you have your business, you're traveling, you got a 1-year-old, you got a 4-year-old, you married, you have so much going on. You don't need to go back to school to get your PhD. There's no reason why. That is too much, Regina. You are always doing the most. That you just need to live. That's what I was told. And so I thought about it and I said, well, maybe she was right. Maybe I am doing the most. Like maybe I don't really need to go back to school, and it would be hard. It would be tough. And, so I literally put my goal on pause for a whole nother almost year, right? A whole nother almost year, because I got one disapproval of my dream. And so even though I am now in school now, and I what happened was, everywhere I turned around, I would just see like PhD programs. And even though I was like, no, it's not a good time for me, I had an excuse why I shouldn't do it. But it never left me. I still had the desire to do it. And so finally I just said, I'm signing up for school. And I just did it. Mark, did I tell you when I was signing up for school? I don't even think I told you. Yeah, I told Mark after. I didn't tell anybody. I was just like, I'm doing this right now. And so that's the decision that I had to do, because I knew that if I stopped and told anybody that I was doing it, there would be a chance that I would get discouraged and I wouldn't reach my full potential. And it would be another year or two before I got back on track. So you guys, just when you decide to do it, just do it. Don't look for approval. Don't get anybody's consent, because it causes you to lose courage and lose faith. Can anybody relate to this? Can anybody relate to this at all? I mean, these are just my real life experiences. And so now I'm in school, but what I understand to be true now is that this, okay? When you make decisions, you cannot get other people's approval for your dreams. You have to take responsibility for it yourself. And what it does is, when you make the decision and you're able to stick with it, yes, it's going to be hard. Yes, it is going to be hard to do. It is hard to get out of, your comfort zone. It is hard to make sacrifices. But when you do that, you're creating a pattern of understanding that in life, you have to give more. In life, if you want to be successful, you have to do more than is what is required, because everybody wants to live up here. Everybody wants to live way up here, but it takes a certain amount of work. It takes a certain amount of sacrifice, and it takes a certain amount of time to live above, right? It's not something easy, or everybody would do it. And so making sure that you don't get into the habit of just thinking that you can get by doing the least, right? You don't get into the habit of just thinking that I can do the minimum and be rewarded for the minimum. You're not going to be rewarded for the minimum. Like there are certain expectations that you are just expected to do because you're an adult. So when it comes to your work environment or your life environment, you don't get rewarded for paying your bills. You don't get rewarded for paying the rent every month. That's something that you're expected to do at your job. You're not going to get rewarded for coming to work on time. Those are things that you're supposed to do anyways. So it really takes not having that type of mentality that you're just going to get by doing the least. That's not how it works. And so when you talk about reaching your full potential this week, you're going to have to set aside time to be extraordinary. Set aside time to be extraordinary. And you know how you can be extraordinary. For us studying for NCLEX or studying for TEAS, being extraordinary means setting aside some time where you dedicate it to your studies. The people that are masters in their area expertise study. The people who are masters in karate are masters in painting. They don't just wake up one day and become black belts. No, they have cleared certain milestones. And I'm telling you guys this, there is not one single person in here that cannot be an expert nurse. Everybody that's watching this broadcast today can be an expert in their field. And I'm just trying to put it in your minds to believe that that is possible. Your full potential, I can't even describe it for some of you guys. Some of you guys will be millionaire. You will be nurse millionaires because you have created a product or you have learned the discipline so well that people are reaching out to you to consult and for your opinion. Some of you guys will write curriculums. Some of you guys will travel to different countries and give speeches about nursing and what you learned. The full potential of some of you guys watching here, you can't even imagine it. I mean, I'm telling you, but you have to have a desire to get there. You have to see yourself as being, yes, all right, being a millionaire, if that's what you want, if you want the money is out there. The money is out there in nursing. Everybody knows that, but it's how you get there. And it's when you get there. And so for us that are watching, don't let small obstacles keep you from reaching your potential. And some of those obstacles can be people, relationships, time. Some of you guys just like to sleep more than you like to be successful. I love that. I love that when Eric Thomas, he's a motivational speaker. He said, some of you guys just like sleep more than you want to be successful. Some of you guys would rather hit the snooze button and go to sleep than to wake up to a check for $3,000 or $4,000. All right. And that's just the truth of the matter. And so I'm encouraging you guys this week to reach your full potential, whatever it is. Start writing your book, right? Start writing your book because you guys have some amazing life stories of how you overcome challenges. Start your financial literacy program. Some of you guys really know how to use money and you guys know how to save and encourage people. Start your hair business. Some of you guys really know how to do, you could be nurse, beauticians, whatever it is, get it started now because you have a lot of life to live and you have a long way to go. And this is just the beginning. I'm happy to be here in the beginning with you guys because I know that you will end up in a very, very different place. And I'm so proud of you already. So I like this. It says to reach your full potential, you have to set goals that will stretch you. You must not be afraid of taking risks. You must learn to recognize opportunity, all right, and have the courage to pursue them. You have to make better choices that will provide better results. Very simple, very simple. Finally, you need to avoid the negative influences of other people and surround yourself with successful people who will encourage you to pursue your dreams. Shout out to all the nurses. Nurse Danette, am I saying that right? Took your NCLEX Thursday and passed. Shout out to you. This is what I'm talking about. This is what I'm talking about. Having the ability to see success from the people around you is so important, and making sure that your goals stretch you, right? Your goals past NCLEX, yes, that is a stretch, but there's another level for you. And it doesn't matter if you have kids, it doesn't matter if you're married, it doesn't matter if you're single, if you're struggling financially, keep going. Don't let any of those things be an excuse, because for the most part, having those things are a blessing for you because they keep you out of trouble, right? Having 4 kids for some of us is a blessing because those kids keep us so busy that we can't get into trouble ourselves, right? And every excuse that you have, I'm like Paul, I can match you with the excuses of not having time to get things done or work on your goals, but I'm still doing it because it's important, and you should too. All right. I know my husband for me is a blessing. My husband keeps me out of trouble. So you guys, thank God for your husbands. Don't use them as an excuse not to study for NCLEX, right? All right. So ReMar nurses, you can do it this week. Let's get NCLEXing. All right. Are you guys ready for your NCLEX questions today? Yes. All right. So NCLEX questions, we got a share goal of 100. Let's try to do it. Let's do it, ReMar nurses. We can do it to unlock questions 5 and 6, which I love. But we're going to get started with question number 1. Don't be mad when you see question number 1. I expect you guys to get it because you guys said, oh, I'm not coming to that TEAS review. You better be at that TEAS review. Question number 1 is don't you love anatomy questions? Sperm production takes place in which of the following? Is it the vas deferens? Is it the testes, the prostate, or the androgens? Loving this anatomy question for NCLEX. Go ahead, put your answer down. Smash that share button and let's get going. Let's get started. Here we go. Go ahead and tell me, because you remember this is basic reproductive anatomy talking about sperm production takes place in which of the following? Is it number 1, the vas deferens, 2, the testes, 3, prostate, 4, androgens? Let's see what we have. Facebook is saying 2, 2, 2, 2, 2. And I got YouTube with 1. Yeah. What is the TEAS? Somebody asked TEAS. TEAS is that the entrance exam for pre-nursing or any allied health. Okay. So if you want to get into nursing school, you got to take the TEAS. If you want to get your license, you got to take the NCLEX. All right. We're here to help with both now. Questions 2 and 1. 2 and 1 are looking like the main answers. Let me show you what the correct answer is. It is going to be number 2. In the testes is where sperm production occurs. All right. If you didn't get that right, you better sign up for the TEAS review with me, and then we'll help get you together with this anatomy. All right. So here we go for question number 2. We're going to keep on rolling today. Question number 2 says, a registered nurse is instructing a group of teenage boys on the female anatomy. We did the male anatomy. Let's talk about female. She should explain that fertilization normally takes place in the number 1, uterus, 2, cervix, 3, ovary, 4, fallopian tube. We're talking about a registered nurse is teaching, and where does fertilization normally take place? I'm interested to see what you guys are thinking about this. And I have a lot of mixed answers. It's all right. Go ahead. I love how you guys are putting what you do know. Say, I know I may not know that, but I do know this. All right. And I'm happy what I'm seeing. You guys really remember your anatomy. All right. That's what I'm talking about. The content never leaves. Here we go. The correct answer is 4, fallopian tube. Yes, you remember. Fertilization takes place in the fallopian tube, and then the egg will migrate to the uterus for growth. All of the other choices are going to be incorrect when you talk about where fertilization actually takes place. Okay. And so don't be dismayed if you didn't get it correctly right off the onset. It's just a place for you to review. That's all. It's just a place for you to review. Okay. Let's leave anatomy and let's get into prioritization. Prioritization, very important. We love these kind of questions. Here we go. It is the start of the shift, and the nurse has just finished listening to a report on 4 clients. Which client should the nurse assess first? Here we go. Number 1, a client with a diagnosis of a head trauma who does not remember his name. 2, a client with a diagnosis of an acute traumatic brain injury who has a blood pressure of 87/55. 3, a client diagnosed with acute renal failure with a serum ammonia level of 15. Or a client diagnosed with viral meningitis and has signs of meningeal irritation. Woo, we got some complicated patients here. All right. Who should the nurse see first? Number 1, a client with a diagnosis of a head trauma who does not remember his name. 2, a client with a diagnosis of an acute traumatic brain injury who has a blood pressure of 87/55. 3, a client diagnosed with acute renal failure with a serum ammonia level of 15. Or 4, a client diagnosed with viral meningitis and has signs of meningeal irritation. I'm going to let you guys think about this one. What do you think? I got all kind of answers on here. Woo! Don't forget, I want to show you guys the last 2 questions, so hit that share button right now on this video. Hey, a lot of people. All right, YouTube, I'm with you. I'm with you on YouTube. Excellent job. Here we go. I'm giving you guys just courtesy seconds, 10 more seconds to think about who your patient is here. And then we got to move on. All right. The correct answer, guys, is going to be, let me see what Facebook put. Okay, 1, 2, 2, 2. Okay. Correct answer is actually going to be 2. It is going to be 2. You know, one thing that really levels everybody out is that we know their diagnosis. So in order for a client to be diagnosed, look, every one of them starts with a client with a diagnosis, a client with a diagnosis, a client with a diagnosis. So that means that these individuals have been tested. We know what their issue is. So when it is not a matter of an assessment, it becomes, okay, who has an abnormal assessment, right? Because all of these patients have given us clues onto what we should be expecting with them. So, for instance, number 1 is a client with a diagnosis of head trauma. All right, what is consistent with a head trauma? All right, what we know about this client is that they do not remember their name. Well, is that going to be consistent with a head trauma? Yeah, that's probably going to be consistent with a head trauma. Even though it sounds bad, right? Somebody that doesn't remember their name, oh, maybe they're confused. Maybe it's their oxygenation level. But no. It's not the case here. We already know that they have a head trauma. Let's look at client number 3. Most of you guys didn't pick client number 3. I don't think anybody picked client number 3. We know that this person has acute renal failure. So we're expecting certain things, certain processes to happen with that diagnosis. They say they have an ammonia level of 15. All right. So here we have somebody with an ammonia level. Actually, it's quite reasonable. So it's not something that we're going to be concerned with. Number 4, some people did pick number 4. The client diagnosed with viral meningitis. Well, what do we know about viral meningitis? Hey, viral meningitis is different from, there's 2 types of meningitis, right? There's viral and then there's bacterial. So which one is worse? Is viral meningitis or bacterial meningitis worse? Yes, that is going to be bacterial meningitis is worse. Viral meningitis is not contagious. It's not as severe, right, in the sense. So we have somebody who has a viral meningitis, and what are they experiencing? Meningeal irritation. Well, am I shocked and amazed at this? Is this consistent with the diagnosis? Yes. So I have to look at number 2, somebody who has another acute traumatic brain injury, but they're having systemic issues. If the trauma is localized to a specific area, I don't want the entire body to be affected by this. What is going on with this patient that their blood pressure is now falling? It is now dropping. So this is the patient who has the inconsistent assessment right now. So we're looking for the abnormal assessment when we know everybody's diagnosis. All right. Does that make sense for this one? Yeah, you have to. You gotta be able to critically think. But here's the trick right here. You cannot critically think without content. It doesn't happen that way. So even if you had all the strategies and tips and tricks in the world, if you don't know what is consistent with head trauma, acute renal failure, if you don't know what viral meningitis is, the difference between viral and bacterial meningitis, you will never figure these kind of questions out. Never. If you don't know your normal vital signs or your normal lab values, you will not be able to pass NCLEX, period. So people that tell me, oh, I failed NCLEX, or I'm preparing to take NCLEX, I failed it a couple years ago, but I'm back at it and I just want to work on critical thinking. There's no such thing. There's no such thing as just working on the critical thinking, because where does it always begin? It begins with the facts, right? It begins with the facts. And that's why when people say that to me, I tell them, if you just want to work on critical thinking and you just want to do questions, this is not the place for you. Because that's not how we pass NCLEX around here or anywhere else on the planet. I'm just keeping it real. So, all right, I want you guys to be able to see those kind of questions and not get intimidated. All right. So, question number 4. Let's move on. Gotta go. The nurse is caring for a patient who recently experienced a stroke. Which of the following statements by the spouse indicates a need for further teaching by the nurse? So when we talk about a need for further teaching, we are looking for the statement that is wrong. All right, we're looking for the statement that is wrong. Further teaching means they're saying something that's wrong. So here we go here. My spouse may not return to normal for some time. 2, I plan on returning to work full-time as soon as my spouse returns home. 3, home health care will help us once my spouse is discharged. Or 4, you will provide me with support during this difficult time. So if you were a nurse and you were caring for somebody that had a stroke and their spouse says one of these statements, which one are you most worried about? Which one do you need to provide some further education on? All right. I'm so happy. It's Labor Day and it's about 700 nurses right now studying for NCLEX. How amazingly awesome is that? Between Facebook and YouTube. Man, ReMar Review, we are setting the standard. We are setting the standard right now. I've never seen anything like this. You guys are incredible. So most of you guys are picking the correct answer. Hey, most of you guys are picking the right answer. I think it's unanimous. I've never seen anything like this before. All right, so the correct answer, as you guys have picked, shout out Facebook, YouTube, everybody's representing everywhere, is number 2. I plan on returning to work full-time as soon as possible. No. That is not going to be the case here. That is not going to be the case. We will have to reorient that spouse that it may be quite some time. It may be quite some time before they're able to return to work. So remember, when you're talking about follow-up instructions or need for further teaching, those are incorrect statements that you're looking for. All right. Hey, did we reach our share goals? Our share goals today was a low 100. So I got to check to see. Facebook is really dependent on you. Okay. Really, really, really. We needed 100 shares. There's 524 nurses on today. Mark, did we get our shares for questions 5 and 6?
Yeah, about 65 right now.
We only have 65. That's okay. We got 65 shares. I need 40 more people right now. If it's you, if you have 2 eyes and 1 nose, I need you to share. Nobody else. Just if you have 2 eyes. If you have 2 eyes, I need you to push the share button right now. How do I remember the content? I've been out of school for 7 years. I think that's a pretty normal question. When you've been away from school for any kind of time, you tend to forget the facts, right? This is my recommendation for anybody that's beginning to get into prepping for NCLEX. This is quick facts for NCLEX. And literally most of you guys know this, but this book is question and answer. So it's a really good way for you to get into studying again. And you can take this with you anywhere you go. It's very portable. But it's a process of reintroducing yourself to the information. And I promise you, once you get into that studying, it will come back to you. There are just some things about the body that you just don't forget. So you can definitely do it. You're having problems remembering too. And that's okay. Even with quick facts, I know some people say, I have quick facts, but I'm really struggling to remember stuff in it. That is totally normal. Sometimes I'll be in my office and a ReMar staff member will be like, hey, on page 64 of quick facts, you wrote this. What did you mean? And I'm like 64. And so I have to actually look. Sometimes you just, even as the author of this book, it still takes familiar studying time. What do you say? Okay, somebody says, you can with ReMar. Nurse Christencia. She says, you can with ReMar. I'm getting the phone here. I did pass NCLEX RN. Oh my goodness. She says, I passed with NCLEX RN last week, internationally trained, 19 years out of school. What an incredible testimony. 19 years out of school, passed NCLEX RN last week, international nurse. You just don't know how amazingly awesome that is. When I went to London last week, just to put out the statistics, right? For internationally trained nurses, and I did this for a Monday motivation too. The first time that an international nurse takes the NCLEX, they have about a 48% chance of passing the test. The first time they take it. And if they fail that test, it drops down to a low 20% chance, right? So out of everybody that takes NCLEX that are international nurses, only 48% of those people pass that exam. So for somebody to say that they've been out of school for 19 years, trained in a different country, because our standards as in nursing, our standards for nursing in the United States is comparable to what doctors learn in other countries. So as a nurse in another country, you don't learn all the things that we have to know here. So when you're coming from another country, not only do you have the cultural changes that you have to know about working in America, but you also have to know a ton more facts and content. And so just shout out, man. Shout out for that testimony. I don't know. Please just tell me how you did it. Please. I know you use ReMar, but what was the studying like? I want to know. So, all right. So, Tanya, you've been out of school for 10 years. You can do this. Okay. You can do this. I just read a testimonial. No excuses. 19 years out of school. That is fantastic. All right, Mark, can I proceed with the questions or do we wrap it up here?
One last time about RNU and then just go.
All right.
This is awesome.
Yeah. Okay. One last time about RNU. I have directions from our commander. All right. So one last time about RNU, guys. Don't forget with RNU, ReMar Nurse University, we are bringing it back to the school nursing review to go over TEAS, to go over NCLEX. sign up remarnurse.com/RNU to get your workbook. Okay, I'm working on that workbook now, and it will go over things. It will go over things that you need for both NCLEX and TEAS. But remember, if you're studying for NCLEX, that TEAS information will be helpful to you. You're going to like it a lot. All right. You're going to like it a lot. All right. So I'm going on with question number 5. I'm just going to do it. Here we go. The nurse is preparing to administer the first dose of... Oh, they got it. Okay. A first dose of an IV antibiotic to a client. Halfway through the infusion, the nurse realizes that the antibiotic dosage is not the same as ordered by the healthcare provider. Which action should the nurse take first? Number 1, fill out an incident report form. 2, notify the healthcare provider. 3, stop the infusion. 4, explain to the client the wrong antibiotic dose was administered. Okay? Think about it and answer. Okay? I'm giving you time. I'm giving you guys time to think about it. Okay? Notify the healthcare provider. 4, tell the client what happened. Tell the client that the wrong dose was ordered so they know what's going on. These are the kinds of questions you can expect on NCLEX. They want to know, are you going to be a safe nurse? Are you going to be a safe nurse? Because it's the research is out. Nurses are making mistakes. They are 100% giving the wrong medications. So we already know that is very possible, right? For a nurse to give the wrong medication. So when that happens, what should be done first? Okay? What should be done first? Think about it. Think about it. Hearts on the screen if you love Monday motivation. Let's talk NCLEX. All right. Good job, ReMar nurses. I think the majority of us knew what the correct answer was. I'm going to show it to you. So the correct answer is going to be always, guys, remember this, always stop that infusion, stop that medication from going into the patient's body, because everything else, every other option assumes that medication is still running. That medication is still running. So if you go to fill out an incident report form, that means that you leave the medication up to go ahead and keep them and fill out some paperwork. Paperwork is never over the patient. Paperwork never, machines, equipment, paperwork never come before your patient. Fires never come before your patient. If you pick number 2, notifying the healthcare provider, some people did pick that. If you call the doctor, I'm just being very practical. If you call the doctor and you say, you know what? I was supposed to give Mr. Brown 200 milligrams of azithromycin. I got 2,000 milligrams of azithromycin running. The doctor's going to say, okay, when did you turn it off? How much did they get of it, you think? And you say, well, it's still up running. I called you first to let you know that I did this. He's going to think you're crazy. He's going to say, why wouldn't you stop the medication? Why are you calling me? Because when you call a doctor, normally there is something that you should have done before calling the doctor. Just for your own, you have the education to do that. So just for you, before you call the doctor, I turned it off. I turned the medication off. I checked the patient's vital signs. Now I'm calling you for the second step, right? Because there's something that the nurse should do for the first step, right? So you would never call the healthcare provider and say, I gave the wrong medication, but it's still running. So tell me what to do. Because what is the doctor going to tell you what to do? He's going to tell you to stop the medication, and then you probably will get written up for doing that, okay? So we want to avoid that. Number 4 says, explain to the client the wrong dose was administered. Friends, When this happens, it has to be done under the most sensitive of conditions. So surely, if you administered the wrong medication to a patient, you definitely want to know what the plan is next. So you would never say, you know what, Mr. Brown, I made a mistake. I gave you the wrong medication. And Mr. Brown would say, this medication right here that's going into my arm right now is the wrong medication. Yes, Mr. Brown, this is the I'm playing it out because I want you guys to see actually how it sounds when you pick this on NCLEX. Yes, Mr. Brown, the medication that's running in your arm right now is the incorrect dosage. What is Mr. Brown going to tell you? Mr. Brown is going to pass the NCLEX because he's going to say, stop this infusion right now. Like, if you don't know to stop it, then the patient will tell you to stop it. And then once the patient starts giving you orders about medication administration, they lose pretty much their confidence in you as a care provider. So the very first thing to do is to stop the medication. Call the doctor. Don't even tell the patient. Stop the medication. Go notify the healthcare provider so that when you do have the conversation with the patient, you can say, Mr. Brown, I gave you an incorrect dosage of that antibiotic. So what the doctor is going to have me to do is wait an hour. You already got this much of it. So we're going to just hold your medication for the next 2 doses and get you back on track. All right. So that will smooth it over a lot easier than just saying, hold on, I gave the wrong medication. Let me stop the infusion. Then I'm going to call the doctor and see what he wants to do. Because all that time, your patient's going to be anxious, they're going to be confused, and you're not going to be available to provide them the education that they need. Does that make sense? All right. So that's how you answer NCLEX questions. All right. And you guys did a great job with that. I think I got another one. Let's do one more. All right. RN is working with an LPN to provide care for a group of patients. Which client would be the most appropriate to give to the licensed practical nurse? All right. Number 1 says the client with a deep leg ulcer requiring wound dressing changes every 4 hours and PRN. Okay. 2, a client receiving 1 unit of packed red blood cells following a cesarean section. 3, a client with an arterial line who is on a nitro preside drip to control blood pressure. Or 4, a client who just returned from a right heart catheterization. Okay, here we go. Who is the most appropriate? Who is the most appropriate to give to the LPN? Okay. All right. Yes. Now, you know what? Hey, yes, Monday motivation is a little early today. The Monday motivation is a little early, but I knew you guys would be up for the challenge. Today. Give the patient that is most stable to that LPN. So guys, just to confirm what you already know, that is going to be patient number 1. I am so proud of you guys. The client with the deep leg ulcer requiring wound dressing changes every 4 hours and PRN is going to be the client who is most appropriate for the LPN. And I'm just going to go over the other options just for the sake of review, So for number 2, a client receiving 1 unit of packed red blood cells following a C-section. For NCLEX, we don't want to give the LPN the client who is unstable or the client that is honestly receiving blood, because patients who receive blood, they need a lot of assessment, which our LPN is not going to be able to do. And we know that this patient is unstable because normally after a cesarean section, We would not expect the client to need resuscitative interventions like extra blood. All right. If somebody who had a cesarean section is requiring blood, it means that they lost a lot of it during this surgery, right? So that patient, yes, like nurse Netsky says, needs further monitoring. 3 says a client with arterial line, right there. Somebody who has a line, an intravenous catheter in their arteries is highly unstable. It is highly unstable. So we would not give that patient to the LPN. Usually clients who have an arterial line are in the ICU. Sorry. And then for someone who just returned from a right heart catheterization, that is going to be a very unstable patient. Not unstable, I should say. The patient could be stable. I'm making the generalization here. But the patient is going to definitely need additional frequent monitoring. And if you give an LPN this type of patient, the RN is pretty much going to have to do all of the work, all of the documentation, all of the assessments. And so it just makes sense to put that LPN somewhere else and have the RN monitor the patient. LPNs are so essential to nursing care. And I don't know what these hospitals are doing where they're phasing them out. They're making them work as nurses' aides. I mean, it doesn't make sense. And it's one of the reasons why we have such a crisis right now is just because of the disregard for the different levels of nursing. And I also think this kind of disregard is what creates the bullying environment, what creates hostility among older nurses and new nurses. It's just ridiculous. But when used appropriately, LPNs, RNs can work together and provide amazing care. But we have a lot of issues with our profession when it comes to that interpersonal relationships and those dynamics. So I know that you guys feel me on that. But back to NCLEX, we'll save that for another discussion. Back to NCLEX, great job knowing who can do what and when, who can do what and when. One more time, guys, we having the Labor Day sale today. You need to sign up for RNU anyways. You might as well sign up for RNU, get the code, buy somebody an early Christmas gift, just tuck it away. Christmas is around the corner. So this is an amazing opportunity for you to gift that Quick Facts book to somebody that you love on Christmas Day. Particularly if I'm thinking about being really cheap this year and giving all of my friends Quick Facts. Would that be inappropriate? I don't know. So here we go. Also, reach your full potential. Reach your full potential today, but you got to believe it to achieve it. You got to believe it to achieve it. Hey, if you have questions about NCLEX or TEAS in terms of how do you get started, what products we have as far as resources go to help you, here's my email, support@remarreview.com. Send it to this email and we will get you squared away. Somebody said, yes, be cheap. All right. Also, we love the testimonials. Can't tell you how much we love them. Pass NCLEX, tell your story, and just inspire some people. Inspire some people that they absolutely can do it. So I'm going to call up Mark. I got to saw a question. When does the sale end? The sale is just for today, and it's just related to signing up for that RNU. So when you sign up for RNU, you'll be able to get the code. Candace, you purchased the second Quick Facts, 5-star Quick Facts. So sign up for that RNU and get the code and get the Quick Facts products for today. And again, it's either Quick Facts or it's the question bank book, one or the other. Hey, Mark.
Hey.
So, we know that this is hurricane season, and it's very traumatic for those living in the southern regions of the United States and also all throughout the Caribbean. Mm-hmm. And so right now, the ReMar nurses would just like for you to pray for safety for those individuals that they don't suffer great losses, and that those who have already are able to be restored 100% to what they lost, and even more.
Yeah, absolutely. Yeah, and this is something that we've been following over the past week or so, even when it came through by Puerto Rico. We saw that information, and I chatted with somebody online who was in Puerto Rico, who's a nurse there, and they're preparing for NCLEX. And I said, hey, before you go, let me know like what's going on the island. How is how's the storm? How's everything going? And they said they work in the ICU. And they basically said things were so busy there that they hadn't even had time to really even think about it or process it.
Wow.
So you guys in the medical profession, nursing, first responders, you have a different like mindset of responsibility, while others are, saying, all right, let me shelter down, stay in.
Right.
Some people are, being those first people on the line to make sure that, everything is going well for other people. And so what we want to do, and what we have been doing, is asking God for a special blessing for those of you and those family members, the individuals that are not only in the line of the storm, but are also responding and helping and giving, even in these moments of darkness. We posted a testimonial yesterday from Nurse Janine. She's from the beautiful island of St. Thomas.
Yeah.
And she tells her story of how she was preparing for the test, and the storm came. It pretty much wiped everything out in terms of power, electricity, everything was down. And she started to reconsider, like, should I even become a nurse, or should I even, I have a lot going on.
All because of the storm.
Because of the storm, started to question herself. But she was able to regroup, find support, find motivation, find a community. And so she was successful, and she came back and shared her testimony. And so we want to pray that same blessing upon everybody in the path of the storm, that your goals, that your dreams, your hope, your outlook on life will not be blackened by this dark moment, but that that the sun will continue to shine. And so, of course, we're praying for your safety and for your well-being. And I actually just thought about like the children going through this situation. Some people have been through storms before, but if this is your first time, or just what it would be like to be a young person. But we're going to pray right now.
We're going to look right here at you,
and we're going to pray right now. And we have a request afterwards as well for a word of encouragement. So let's go ahead and pray.
Okay.
Father in heaven, thank you once again just for an opportunity to come humbly before your throne of grace, Lord. We know that Lord, that the earth is yours and the fullness thereof, Lord. There's nothing that takes place here on this planet that is outside of your control or supervision. So, Lord, ask that you would calm the hearts of your people, the hearts of the individuals that are in the path of this storm, to know, Lord, that storms do come, but they also do pass. Ask that you would allow individuals to make the right preparations to brace for the storm. And if it be your will, Lord, that you would simply steer the storm in a different direction so that it does not bring hurt or harm, Lord, to life. Things can be replaced, Lord, but we value people above all, Lord. So I ask that you would just be with the families that have family members in the path of the storm, that you would watch over their hearts and their minds and their souls, so that they know that nothing can overcome them, except for that it's measured by your balance first. This blessing of safety we ask, and also a special dispensation of grace to those first responders, to the medical workers, to the firefighters, to the coastal workers, Lord, that they would be extra proficient in their duties, Lord, and so that they can save anybody that needs to be saving, and that they will be acting as your hands and your arms and your feet. In Jesus' name we pray, and watch over these individuals, and we pray. Amen.
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 Yeah.
Amen. I mean, it's such a beautiful place to be near the water and the coast, but you see the power and just kind of, puts it all in perspective when you see storms like this coming.
That's true.
I do have one request for you all. As Regina said, you are a living testimony. If you're in that area, you're going to go through this. You're going to come out good and better on the other side.
Yeah.
And so we want to use our lives and the things that we do to help bless others in the process. So she talked about testimonials for those of you who are passing NCLEX, doing your video. I want to do something that will give everybody an opportunity to participate. Not only to have you passed NCLEX, but just for you to encourage somebody else to enter into the nursing profession. As you know, we started the TEAS training. And so that's coming up. It'll be released during ReMar Nurse University coming up September 15th.
Yeah.
But the request is simply this: if you just make a short video encouraging somebody else in terms of why you decided to become a nurse. right? So
Nice.
why did you go to nursing school? What was it in you that maybe that God spoke to you, or that you saw a need that you wanted to go to nursing school and to become a nurse? Why are you pursuing this nursing profession?
Wow.
And I want you to simply do a video, put it on our Facebook page, put it in the group. We will find it. And so that way we can share and encourage other individuals who want to be where you are. You know, you might say, okay, I wish I had passed NCLEX, but there's others who just want to get into nursing school.
They do.
And so thank God for the blessing that you got in and that you graduated, or that you got in and that you're working towards that degree. So if you do us that favor, we really appreciate it. We want to be an encouragement and a blessing to as many people as possible. Thank you for praying with us today. And I look forward to seeing you guys again on the next
Monday Motivation. Yeah, Monday Motivation. Thank you, Mark.
Thank you so much.
Thank you for stopping by.
Take care, guys.
But Mark is never far away. So yes, that is an amazing opportunity. We talk about getting somebody into nursing. Oh man. And when you read the stories of those individuals who are trying to pass this TEAS test and they don't have it like we have it. I mean, literally when it comes to NCLEX, there's reviews and there's all kind of things, but for TEAS, it's really a desert-like in terms of getting all your information in one place and having a community. It's really tough. And so there's mothers with, just like us, there's mothers with kids and, you know, mothers struggling, international nurses that want to come in, or international healthcare professionals that want to come in and get into nursing. They need a community. They need us. They need us. They need our prayers. They need our encouragement. They need Monday Motivation. You guys know how impactful Monday Motivation is to yourself, and how I know how impactful it is to me. They need these same kind of resources to help them get into nursing school. So by our own dedication, if we're out of school for a long time or fails, that lower our passing. Okay, hold on, Gil. So by our dedication, we will help them to have those same resources. So, okay, so what I said about the passing rates, earlier in the show before I close, I looked at the statistics for 2018 of all the people who tested, and do I, you know what, let me see if I have it. So just so I know, I'm going to take a second just to look this up really quickly so I can give you the numbers. I did it for a Monday Motivation not too long ago. But what I'm going to tell you is, I'm going to tell you what the passing rates were for last year for NCLEX World Conference. And of course, my computer is being slow about this now. So let me see if I can find it. Okay. So the passing rate, bear with me, guys. Thank you. Okay, let me see here. All right, it's coming. I promise. You guys would not believe I have 3 laptops in front of me right now. So, okay, so the passing rates were, okay, so these are the passing rates that I'm just reading from my laptop here. So last year, if you were trained in the US, the first time, and I think there were like 160,000 people who took NCLEX last year for the first time, and this is NCLEX RN, 88% of those people passed it, which is great. It's great. If 88% of people who take NCLEX the first time, NCLEX RN pass it, that's a really high number, right? That's a really high number. But for those people who took it for a second or third time, that means a repeat test taker. If you took NCLEX for a second, third, fourth, or fifth, or sixth time, only 43% of those people passed the test. So that means that more than half of the people as a repeat test taker who attempt the NCLEX exam will fail it. That's just the point of it. All right. You'll fail the NCLEX exam. Now, if you are, because there's only a passing rate of about 43% of the people who take it. Now, if you are an international nurse, The first time that you take NCLEX, and I believe there was about 30,000 people, international nurses that took NCLEX, only 44% of those people passed that test. All right. Only 44% of those people passed that test the first time they took it. And that's why it's so important for international nurses, when you are attempting to take NCLEX, don't take it lightly. Don't think that you can cut corners or you can just read a book or do UWorld questions. Don't think that, because the truth of the matter is that only 44% of the people that are taking it are going to pass. Now, if you're an international nurse, and you're a repeat test taker, out of everybody that repeats the NCLEX as an international nurse, only 25% pass. That's all I'm going to say about that. Okay? Only 25% of the people pass that test. So, I mean, what do you recommend to help pass with the RN exit exam, meaning HESI? I think for HESI, you can prepare for NCLEX as you would for HESI. So they're going to have the same kind of principles and the same kind of content on the exam, because one is an exit exam and one is a licensure exam. So you're going to have that same kind of content there. But really the truth of the matter is that if you are a repeat test taker or international nurse, you have about a 40%, only about 40% of you are passing NCLEX. Just to be honest, if you are a repeat test taker or international nurse, 60% of you are going to fail the NCLEX. So for the 40% that is passing the exam, great, that's fantastic. But for the rest of you, there needs to be some sort of remediation, because honestly, the more times you just take the exam, the more times that you have the more times you take the exam, just the more times the probability of you failing is just greater. I mean, that's just what the research shows. So that's why we focus on really making sure that you're up to par on your content and that you're up to par on, being able to understand that it's a process and it's a journey, and it's not just you. Some people think, oh, it's just me, I can't pass the exam. But no, the majority of people who are repeat test takers don't pass. And what happens is they get discouraged and they don't test again, right? Or they just keep on testing, just blindly, just keep on testing, going back, thinking that they have a higher probability of passing, but they actually don't. So for us, we have to all start at the same place. And that is understanding that it takes about 6 weeks to prepare for this exam. And it's not a 6-week, 20-hour a day, every day kind of event. Or it's not a 2-week flash cram, session. It's a process, right? Just like it took you a lot to learn nursing content, right? So the computer won't allow you to pass. It's not that the computer won't allow you to pass. The computer doesn't have any bias against international nurses. The computer doesn't have any bias against, repeat test takers. The bias actually comes inherently from this whole idea of doing a standardized test. But once you get in front of the test, what the computer is measuring is your ability to pass a certain level of question throughout the test plan. So everybody that sits in front of the test will get exposed to all parts of the test plan and questions written at the application level, the analysis level, the evaluation level, or sometimes it's just the comprehension level because the person is not really able to clear those higher level questions. So what you have to be prepared for, and know is that the computer will not stop you until it has made a determination that you have a certain probability, right? You have a certain confidence established that you can pass the exam, right? That 95% confidence rule. And so it is a matter of you being able to get in there, stay mentally focused, but also have the foundation of nursing information, right? Because it's a mental thing. Some people, and yeah, you don't have to be scared of it at all. Some people go into the exam fully knowledgeable about the nursing process and nursing content, but they're so anxious and they're so afraid of this computer, right? Because that's all it is. They're so afraid of this experience that it allows they allow the anxiety to take over their confidence in themselves. They allow that anxiety to wipe their mind blank. And you guys know when you're anxious and when you're scared, you can't recall what 1 + 1 is, let alone a list of lab values, right? Or medications. So we really have to understand that a part of the difficulty of NCLEX is really getting over the idea that this is a life-changing exam, right? But understanding that whether you pass or fail NCLEX, life goes on. Whether you pass or fail NCLEX, you're still more than capable of living out your dreams. No patient, even if it takes you 7 times to pass this test, you determine that you're going to pass it, because no patient is ever going to say, well, before you work on me, how many times did you take that NCLEX? Because my limit is 3. I don't allow nurses who have failed the NCLEX more than 3 times take care of me, right? That's never going to happen. When you become a director of nursing, I guarantee you nobody will ask you how many times you had to take NCLEX. So just get it in your mind that this is not the end all and be all of anything. This test is not stopping you from achieving your goals. All right. That's the starting point. Did I answer your question? Okay. All right. So yeah, guys, I mean, it's all about, it really is. Yeah, we have RNs, PNs. It's all about making a decision that this is where you want to be. You want to be a nurse, and you're not going to let anything get in the way of that. You guys are more than capable. All right. If you fall, just get back up again. Just get back up again and continue to understand that in life, there'll be ups and downs. Things will be easy. Things will be hard. But the really hard things are the ones that are worth it. Being a nurse can literally change your life. It is a craft that can serve you in so many ways. So let nothing, let nobody, let not even your own self get in the way. All right. Not even your own self get in the way. We have this little saying around here. We started it about last year or so. I don't know if you guys remember, but we have this little saying around here, and it is just, we can, we will, and we must pass NCLEX. We can, we will, we must pass NCLEX. And that is also HESI, TEAS, anything else. All right. Anything else that is in our way. We can, we will, and we must pass it. All right. See you guys later. Bye-bye.